Welcome to the MamasteFit week by week pregnancy update. We are now in week 29 of the pregnancy week by week update, and I am currently pregnant with baby number 4, so I am on this journey with you. If you are pregnant, be sure to comment below to let us know how you are feeling because we would love to connect with you on this journey. Hey, my name is Gina. I'm a perinatal fitness trainer and birth doula, and again, currently pregnant with baby number 4, so excited to share my personal experience as I navigate this pregnancy.
And I'm Roxanne. I'm a labor and delivery nurse and student midwife and mom of 3, and I'm excited to support Gina on her journey.
But before we dive into what to expect during week 29 of your pregnancy, I want to share that my book Training for 2 is now available for pre-order. Training for 2 comes out September 10th of 2024, just a little bit after this baby is due. So depending on when you're watching this video, the book may already be out. But Training for 2 is all about how you can use your prenatal fitness to stay strong throughout your pregnancy, pain-free, because pain is not a requirement of pregnancy. And then also how you can use your workouts to help prepare for birth by creating more space within your pelvis, releasing tension within your pelvic floor. So there's a lot of information in the book. It comes with pictures and also with QR codes to video breakdowns, because sometimes it's easier to see an exercise in movement to know what to do to how to prepare for your birth. So check it out down in the notes below. We would love your support with your pre-orders. So Roxanne, what is going on with baby during week 29 of pregnancy?
All right, so week 29, third trimester, getting real, almost there.
Any day now.
Any day. No,
Just
not any day now.
Just kidding.
Not any day now. Still got like at least 11 more weeks to go, especially for Gina. But baby is the size of a butternut squash, if the vegetable, again, resonates with you more, or a fanny pack. But I think it's important to note that the fanny pack is probably like the 90s fanny packs that are like decently sized, not these like little tiny ones that you can get at Lululemon. So bigger. Think of a butternut squash sized fanny pack. But baby, during this week, there are a lot of exciting things happening. So before their skin, is still pretty translucent, but they're starting to, again, put on more of the fat now that we're in this third trimester. So especially it's the white fat deposits, which this type of fat is really important for, number one, their temperature regulation and stabilization once they're born. So this fat will help them be able to kind of figure out and regulate their temperature so that they're not getting too cold. Number two, this is where we store a lot of our energy is in our fat. So baby is storing all of this fat now so that they're able to use that energy later, number one, to help make their brains bigger so that they can grow their brain and development. And then the other, obviously, like benefit of the white fat is it makes their skin less translucent. So they're like starting to look like a real human, a real person in there. And they're just like fattening it up. So now they're going to get like cute little cheeks, little rolls. So they're just getting cuter the more fat that they put on. Their bones are starting to harden now, so that they're getting stronger. They're starting to harden a little bit more, as well as their muscles are getting stronger. So you might start to notice that when they do their kicks and rolls, they're a lot stronger now. So it's beneficial for them, but may not feel great for you whenever they kick you now that they are just like putting on the muscle.
So if you are having a lot of pain with your baby's movements, we have this ligament that comes across the front of our uterus known as the broad ligament. And so if baby's kicks and punches are like kind of painful or uncomfortable, that ligament could have a lot of tension in it. And this is where like a belly band could be really helpful. Doing movements where you're kind of like pulling your belly in to support it, or even like belly sifting with like a ribosome can be really nice to kind of help relax your belly, or even like belly massage. I get belly massages from my massage therapist, which are always like really nice to help like release some of that tension. But if their movements are painful, it could be broad ligament tension.
Swimming also can be really helpful, or just going in the pool, because it makes you weightless, which what all of those things are. It's taking the weight so that ligament can relax. So swimming can really be helpful as well. So just another reason, go to the pool. It's for a baby. Another thing that's really happening this week is baby's hair is starting to grow, if they have hair. But like their eyebrows, most babies will have eyebrows when they're born, in their eyelashes, which babies have like the most impeccable eyelashes. It's a little unfair. And then if they do end up having hair on their head, this is when it's like, it's started, third trimester. Their hair is just growing. Those reflexes as well are starting to develop more. They're getting stronger so that when they come out, they're able to do all of those reflexes like the palmar grasp. So like when you put your hand in their hand and they grasp it, they're starting to develop all of these reflexes now. So baby's almost ready to be born. Almost, but not ready just yet. So for you, week 29, some pregnancy symptoms you might be experiencing at this point is constipation. Very common. Very, very common. Progesterone is a great hormone for gestating, but it's not great for constipation.
Your GI.
Yeah, it slows everything down to include your digestive tract. So constipation is very common. Things that we can do to kind of help relieve the constipation is increasing the amount of fiber that you're intaking. You can even just take like a fiber supplement. So like the Metamucil type fiber can be helpful to increase the amount of fiber to allow things to kind of ease through quicker. Hydrating, so hydrating with water, but also those electrolytes. Magnesium can be really helpful as well. So obviously our favorite electrolyte is Element. If you want to try them out, you can grab them at the link below. It comes with a free sample pack. We really like the Insider Bundle because you get 4 for the price of 3. It's a really great deal. They have a really great refund policy if you don't enjoy them, which you will not. You will not hate them. They're so great. But hydrating during pregnancy is really beneficial. So hydrating, fiber can help relieve that constipation, which can be really, really uncomfortable. And if you do have it, it also could increase your risk of hemorrhoids, which is already a common symptom during pregnancy as well. So try to increase those 2 things to help with that. Another thing that can happen during this trimester is your belly's getting bigger. So you might start noticing that if you lay on your back for a longer period of time, you might start feeling lightheaded or dizzy or nauseous. And this is just due to we have 2 huge blood vessels in our back that are directly behind your uterus. And if you lay back as your uterus gets larger, so this is like 3rd trimester and on is usually when people start to feel this, you might start to feel these symptoms because the uterus is placing compression onto those great vessels and decreasing the amount of blood flow that is like going to your body, especially like back to your brain. And then this causes that lightheaded feeling. This isn't usually a concern, like unless you continue to lay there. Most of the time you're going to feel this way. As soon as you lay onto your side, the blood flow will return and the symptoms will go away. But this is like a really common concern that people have when they're working out is like, oh, well, they say I can't lay on my back anymore. Like I can't sleep on my back. I can't lay on my back. Most of the time, we are usually fine for a short period of time. If you lay on your back and you start to experience the symptoms, then I would avoid laying on your back. But for most of us, we will naturally move out of this position if it is causing us harm. This, if you don't move out of the way, is concerning because our bodies, if we start to feel like blood is not perfusing the vital organs like our heart and our brain, it will start shunting blood away from the non-vital organs, which surprisingly is your uterus. It is not a vital organ for survival, but it is a vital organ for baby survival. So if you start to experience it and you don't move out of that position, that's when it could be concerning. But for most of us, it is completely fine. If you experience it, move onto your side, lay there for a little bit, and it will resolve. So it is okay if you need to do your bench presses to continue laying on your back for bench presses if you feel fine. But there are also modifications that we can do if we do want to avoid laying on our back.
So one of the other things is folks will get really concerned if they wake up on their back when they're sleeping. And usually this is just your body's sign to let you know that you rolled onto your back and it was starting to get uncomfortable. So it woke you up so that you can roll, or you'll just kind of roll on your own. If it is something that is really concerning for you, where you're like, it brings me a lot of anxiety to wake up on my back, you can use a lot of different pillows to kind of support you so that you can't roll onto your back as well. So you can either have more pillows so you're more reclined or a little bit more upright. You can have the pregnancy pillows that prevent you from rolling onto your back. But know that if you do wake up on your back, it's okay. Usually that was your body letting you know that you were on your back for a little bit too long, and it was encouraging you to change your position.
Another thing that we might experience now that we're in the 3rd trimester is anemia. And this is because our blood volume essentially doubles during pregnancy to accommodate the blood supply needed for all of the changes, especially baby. And one of the main ingredients of our blood cells is iron. We need iron to create hemoglobin, which is part of our blood cells, to transport oxygen throughout our body, especially also to baby. Without the iron, we can't really make hemoglobin. But we only have so much iron stores within our body, and we don't get a lot of iron from our diet as easily. We just don't absorb. Like if you took in 30 grams of iron, that's kind of a lot of iron to take in at once, but if you took in 30 grams of iron, likely you're only getting like 5 of those grams. It's like you get like 5, maybe 10% of the iron that you're actually eating into your body. So you might start to experience anemia, especially if you weren't taking in iron, because they used up all of the iron stores to create this blood volume that's now in your body. So if you start noticing symptoms that you have low iron, such as fatigue, like just really weak, like you just feel like napping all the time, you might notice that maybe your skin is a little paler than usual. These are all signs that you might have anemia, and it's not just pregnancy-related fatigue.
You can also have increased anxiety due to low iron levels because it can impact your serotonin levels, which is really fun. And so I have very low iron levels, apparently. Borderline anemic, not quite there, but like pretty much there. So because my iron levels are dangerously low, I've started taking needed iron to help increase my iron levels so that I could stop being so borderline anemic. And what's really great about needed is they let you know how much to take based on your ferritin levels. And so I'm taking like max dosage because I am super depleted. And this is something that I'm going to work with my provider on to figure out what else can we do to help to increase my iron levels. And so things like taking B12 can be beneficial. Some folks say to take like chlorophyll, which can help with increasing like blood cell development as well. And so I'm going to talk with my provider specifically on what I can do to help increase my iron levels, because I would like to not feel super anxious and tired all the time as I prepare for the final months of my pregnancy.
Yes. So that is another side effect of anemia, is that you can have anxiety, but also depression. So whenever someone comes and has any symptoms of depression, we always need to rule out both anemia and thyroid issues, because those can be together, which Gina now has both.
So I'm doing good mentally over here. Physically, I'm fine, though.
With anemia, so Gina is borderline. So this is what we would call early iron deficient anemia. So she's not full-on anemic yet. She just has low iron stores. So we can hopefully try to work to rebuild those iron stores by taking the supplement. And that's why needed, we really love needed, because the dosage is based off of what your actual level is. Because some of us may never need to take an iron supplement. You might just have really great iron stores, and you might like have a really iron-rich diet and absorb iron very easily from food, because we are all different. Like we can absorb different nutrients differently. Or you could be like Gina and I, who do not apparently absorb iron very well from food and are just very depleted in iron. So taking an iron supplement based off of your ferritin levels, and not every provider will draw a ferritin. So if you feel like you've been fatigued, really tired, weak, not able, like really short of breath super easily when it wasn't really an issue earlier in pregnancy, these could all be reasons to ask your providers to not run just your like hematocrit and hemoglobin levels, which are important for like assessing anemia, but also drawing an iron panel, which includes like your iron stores and your ferritin levels. And based off of what your ferritin levels is, will tell you how much iron you should actually be supplementing.
At my 28-week appointment, which was last week, my provider just asked me if I wanted to get my ferritin levels measured, because she knew like during the 3rd trimester, more folks kind of struggle with this. And so it was something that was already on their radar, and they were willing to offer to me, which I was like really appreciative of. And obviously I was low, so I'm glad I found out.
Yeah. But it's not like routine. So it's nice to know what to ask for if you feel like you're having these symptoms, rather than someone just being like, well, you're pregnant. Of course you're tired. You're growing a human, which you are, but you shouldn't be so tired that you're not able to do the normal things that you're once able to do. So that's really it for week 29 for baby and you. But how are you feeling, Gina, other than severely anemic?
Other than I'm not severely anemic. I'm borderline anemic. So physically, I feel great. I've been really consistent with my workouts, so I'm not having any pelvic pain, any back pain, like feeling very good physically within my body, which I'm really excited about. Usually by this point, I have some sort of aches and pains, but again, been really consistent with my strength training. And so I think that's really been helping me to not be in pain, which I'm really excited by. Mentally, though, I could use some work. So my low iron levels are definitely contributing towards a little bit more anxiety, especially at night for me right now. And so what I have started to implement to help me kind of relax and to calm down is I've been drinking needed sleep and relaxation support at night, which has tons of magnesium, has chamomile in it, has a bunch of things to help you kind of chill. So that's been really helping. And then I've been listening to gentle birth meditations at night as well. So like some sleeping meditations, I fell asleep during them, which is my goal. Because usually it's when I'm like laying down in bed and trying to go to sleep,
Pull out
that
the
I get
rainbow
like really
relaxation.
anxious. So the meditations have been really helpful as well to help me feel a little bit calmer as I go to sleep because I've been having more anxiety and insomnia at night. I get really anxious as the night comes, which then adds to more anxiety and insomnia because I'm kind of anticipating this panic to happen. And so it's just a bad cycle. So the sleep support has been really helpful. And then the meditations has been a really helpful thing. And then also the meditations are going to be helpful as a part of like birth preparation as well. But my main focus right now is trying to get better sleep. And the way to do that is try to be less anxious. Just be calm. Just calm down.
Just calm down.
Just calm down.
You need
But
to
been
calm
really
down.
diligent with taking my iron supplements as well and taking them away from my prenatal vitamin because there are things in the prenatal vitamin such as calcium which could impact how well I absorb the iron. And I am trying to get all the help I can.
You're trying to absorb all the iron.
I want all of the iron as much as possible. So I've been really like deliberate as to when I take my iron in comparison to other supplements and also not taking my iron with my thyroid medication because they could inhibit the
thyroid absorption.
Yeah, so taking iron and my thyroid meds together makes it so I can't absorb my thyroid medication very well, which I also need.
But also aids in your absorption of iron. So it's
like, come on, just help me out here. So that's been like my main focus lately. I ordered all my home birth kit stuff, so that'll be here in like the next week or so, which is pretty exciting to kind of be on that end of my pregnancy. I feel like I still have a lot of time to go, but you know, it's always good to have it just in case.
Yeah. I mean, you wouldn't use it until 37 weeks, so then it would just be there if you went into labor before, but
so yeah, that's pretty much. Physically, I feel great. Mentally, I could use some work. I could use a little bit of work at this point. So yeah, but otherwise, feeling pretty good if we just ignore all the anxiety, insomnia,
yeah,
and low iron levels.
So if you are also feeling anxious or depressed, you can, one, ask your provider to do like some blood work to see if maybe your iron is low as well. So, and then you can do iron supplements to hopefully make that anxiety and depression better. You can always find a mental health professional to actually talk through your feelings if you're feeling that maybe it's not low iron and maybe you're just needing to work through some stuff during pregnancy. We'll have a link below that you can use to find someone who specializes in the perinatal time period and is a mental health professional.
So thanks so much for watching What to Expect during week 29 of your pregnancy. Again, if you're pregnant, be sure to comment below to let us know how you are feeling. Are you also dealing with low iron levels and feeling physically great but mentally not okay? Like, let me know on the notes below so I can commiserate with somebody else. If you want more support throughout your pregnancy because you want to be pain-free like me, join our online prenatal fitness programs. Probably won't help you mentally though, but it can help you physically to move pain-free throughout your pregnancy and to stay strong as you prepare for birth. We offer our prenatal fitness programs in two main formats. We have our app-based program, which is going to be a list of exercise with short demo videos. And this is going to be self-paced workouts, a really great option if you like to work out in a gym setting and with a barbell, and is the program that I am currently using throughout my pregnancy and what we use with our in-person training clients here at the gym. We also have our on-demand program, which is going to be full-length workout videos that you follow and work out with at the same time. If you prefer to work out at home or you enjoy watching somebody else work out and then following the movements at the same time, this would be a great option for you. We have this with our fitness training program. We have just a birth prep program. So if you're only looking for the birth prep exercises, that program is a great option for you. And then we have prenatal yoga as well as all of our on-demand options.
And if you're looking to help prepare mentally for birth, you can check out our online childbirth education where we discuss the science of labor and birth to kind of take some of that mystery and fear away from the birthing process. We discuss labor comfort measures, labor positions, different birthing interventions you can utilize. You can check out both the childbirth education and our prenatal fitness on our website at MamasteFit.com and use code YouTube10 to get 10% off any of our offerings from prenatal fitness, postpartum fitness, childbirth education, postpartum prep course, or even our professional course.
And you can bundle the fitness programs with the education courses to save an additional 15% off. So thanks so much for watching. Be sure to subscribe to our channel so you get notified whenever we release new videos. We release one new workout video every week and a few educational videos every week as well.